Right, quick one. What's the difference between intramuscular injections and subcutaneous injections? Well, put very simply, when you inject into muscle, your muscle is highly vascular, so it gets into the systemic circulation very quickly. So then, obviously, the esters can be dehydrolyzed and the subsequent testosterone can be released so they can get converted to free testosterone, estrogen, DHT. So, wonderful, everybody thinks. But actually, no, you want stability and you want a slow absorption so that you don't get that subsequent spike in free testosterone, estrogen, and DHT. Is that a problem for the majority of people? No. But really, it normally comes down to the issue with the conversion of testosterone to estrogen. So, intramuscular injections are an extremely effective method of raising your testosterone and subsequent bioavailable androgens. However, it can be slightly complicated by the fact that it will ultimately end up in an increased amount of aromatization and the dreaded estrogen. So, subcutaneous injections, that's the way forwards. Well, it is and it isn't. Okay, subcutaneous injections are injections into the tissue between the skin and the muscle. Now, pros about this are the slow absorption. Now, why is there slow absorption? Now, it's not directly going into a highly vascular system. So there are tiny capillaries which then go into the veins and then into the systemic circulation, which is part of the systemic circulation, sorry. It goes into the lymphatic system, which then drains into the systemic circulation. There's also adipose tissue, so fat, fibrous tissue, and collagen. So it is slightly complicated by the route of administration, and it is the way forwards 100%, but it doesn't suit some people. Now, why doesn't it suit some people? Well, let's have a guess. Because of what we've just discussed. The tiny capillaries, lymphatic system, which is all brilliant from the perspective it's going to slow absorption down, but it's slightly complicated by the fact that if you are a chunky monkey and you do have a lot of adipose tissue, so fat, then that absorption process can be slightly hampered, and it can sometimes be a bit of a pain in the butt to actually raise your levels. So if you can tolerate sub-Q and your levels do get to their optimal levels quickly, then it definitely is the way forwards. Now, why is that? Because if it's intramuscular and you get there, that gets you there. If it's subcutaneous, it gets you here. What's the big difference? Now, the big difference is obviously pain and subsequent risk of scarring. So, subcutaneous injections are far less painful than intramuscular injections. Now, is that always the case? Well, no, it's not actually always the case. Now, why is that not always the case? Well, it depends on what ester you use. Now, if you use Sustanon, the huge benzoyl alcohol content in that makes it a real pain, literally pain, for doing subcutaneous injections. So if you are injecting Sustanon, then really, I would always inject intramuscularly, because the benzoyl alcohol content will make subcutaneous injections pretty nasty. Next, enanthate, far better tolerated subcutaneously than Sustanon. We do have a few guys who have had localized reactions. Now, why is that? That's because of the chlorobutanol content of enanthate. It is an irritant. Normally, it's allowed to up to 0.5% in substances. However, in testosterone enanthate, it's 5%. So unfortunately, you can have a mild reaction to testosterone enanthate if injected subcutaneously. Is it a problem? Well, nobody's ever come off of enanthate because they have a reaction. They do sometimes complain of it, but it's tends to be infrequent and not particularly troublesome. Now, if you do have a reaction, what you really do need to understand is if you do have a bad reaction, that inflammation can act as a feeding ground for bacteria. So you do run the risk of developing an abscess and then potentially becoming quite unwell. So what are the signs of developing an abscess and becoming unwell? Well, obviously that redness gets worse and it actually becomes more defined, so more of a lump, and the redness tracks. Now, if you start to feel unwell, fever, nausea, vomiting, then that really is time to seek help. Has it ever happened? Not to my knowledge, but you just do have to be aware of it. Now, the best option for subcutaneous injections is testosterone cypionate. Now, as you may know, the Men's Health Clinic is the only clinic in the UK to secure an import license to bring testosterone cypionate into the UK. We're actually expecting our first delivery any day, so we will be offering testosterone cypionate at the Men's Health Clinic. Only us. So if you want it, you've got to come to us. Always the first. So yeah, it's testosterone cypionate has a very low benzoyl alcohol content, so it's also far less viscous than enanthate. Instead of sesame oil, it's got cottonseed oil, which is it's almost like water. It's incredible. When I compared the two, when we had our first little sample, I was super impressed. It kind of makes sense now watching some of the videos that the Yanks put on, and they just draw the testosterone up like it's nothing, like it's water. And then we are in I wondered if it was because we were so cold in the UK, but it's not. It's actually the carrier oil is just so more fluid. So it is going to make it a perfect option for subcutaneous injections. As you already know, TRT is an evolving process. So the reality is, if you haven't tolerated sub-Q and you're back on IM, it is always a work in progress. So if you're a chunky monkey and you lose that weight, then it's something to reconsider, and I will work with you, obviously, and you will do what we need to do to get you optimized, healthy and happy and horny. So what was supposed to be a 2-minute, what's the difference between IM and sub-Q, has turned into 8 minutes now. God, I'm even bored of my own voice. Okay, so I will leave you with that thought. Enjoy, guys. Have a nice weekend. Over and out. Watch a lot.